877, please. And med search is done in the book. La book. Yes, la book. Yes, baby. Page 877 in the green book. The first drug, first of all, what is multiskeletal drugs used for? These drugs used as muscle relaxers. Yes, people say opiate. They're not opiates. Opiate is Vicodin. Opiate is morphine, Demerol. These help with sprain, strain. Right? I pull my muscle. You give muscle relaxers. Okay? The first drug is called baclofen. Lirasil. Baclofen, Lirasil, right? And one thing I want to say, she went to Hawaii because she wanted to. I told her she had enough ammunition to go to Florida. She would have still gave me the license. She's bad. B-A-D-D. And look at something with Madeline. Madeline is older, Haitian woman. She got kids. And you know, Madeline English, she's not Americanized. Parle nan NCLEX still passé. You see, it have nothing to do with moun qui parle anglais. It have not. Madeline know her material. She stood up here like me. You say atomic disrespect. How can a student like that go to people test and don't pass? I don't care if you go to Hawaii, California, Florida. She knew her content. She could go anywhere and pass. With English, it's not about English. It has nothing to do with English. Do you believe me? It has to do with Kisa. You got it? So put English away. Put Coplan up. Okay? Let's go to baclofen Lirasil. Baclofen is a drug they give for muscle relaxers, right? Now, baclofen is given in a pump. In a pump. But you cannot let the pump go empty. You cannot let the pump go empty. If baclofen goes to 75%, ukite 75% empty, the patient can go into distress. That's a medical emergency. So anytime you hang in baclofen, you must change the pump when it's 80%, right? You don't wait till it's 50% empty and fill it. You guys, you get it? So here it is. Baclofen, go to D, causes CNS effects, drowsiness. Guys, you guys know it's a muscle relaxer, so you give it at night. Baclofen, D, instruct the client, the pump, to maintain the medication refill appointment, to prevent the pump from emptying. If you let the pump empty, the patient can have what we call withdrawal symptoms. NCLEX question. Okay? And let me show you something, diamond. You see the diamond in the book? What Brianna said? Shine bright like a diamond. Diamond means red, red, and important. Depuis nous voyons diamond, tu vas vers ça, baclofen here. Any question? Yes. That's right. Hey, what are you going to do? You're going to do what I tell you to do. If I don't do it, that means it ain't important. Look, NCLEX asks you 75%. I gave you the 75% to go pass. All right? Okay, let's go. Then we go to Soma. Soma Corispidol is just like Motrin. that's her alarm.
Yeah.
She did. Okay. Soma. Soma causes stomach problem. Soma is just like aspirin. Soma is just like Motrin. You cannot take those on empty stomach. C'est pour prendre à manger. Soma. Risperdal. And these medications are called C3s. Baclofen, Soma. You cannot leave them at the bedside. LPN. Yes, they in the narcotic cart. Then we go into what we call Flexerol, which is cyclobenzaprine. I want you to put I cannot open piercing door without knowing. That is a top 200 drug, Flexerol. There's a depression drug called Marplan, which we will learn in psych. They are called MAOIs. Anytime you take this drug, you cannot take it with an MAOI. You gotta take them 14 days or 2 weeks separate. This drug, Flexerol, is never to be taken for 6 months. I'm on page 877, number 4. Okay, and let me explain to you guys when you taking notes. I noticed the reason you don't know what page I'm in, because you're writing notes on a piece of paper. You need to take notes in your book. That's College 101. When you're taking notes, we clean on you like right in the book. So because if you writing on a piece of paper, what I'm saying, you're losing it. But if you can see it in the book, what I'm saying, it's right in the book. So number 4, page 877, I want you to write your notes here. Number 4, page 877. Number 4, right, bottom, 877, number 4. Okay? Mommy, number 4, 877, you in the right. No, but you should be on the right-hand side. You on the left. That's why I know you in the wrong place. I'm alert, wanted, time technician. Right? 877, number 4, Flexerol, is contraindicated in clients taking MAOI. That's what I said. Anytime a patient on Flexerol, and they also taking blood pressure medication, the Digoxin, you should question that drug. Turn. Now I'm on page 878. Who cannot take Flexerol? Who cannot take Flexerol? Glaucoma patient. So NCLEX asks you, which drug would you question? I did it last week. I with a patient that's taking Flexerol. Mes level 3 question. Mes level 3 question. Okay? Flexerol is only taken 2 to 3 weeks. Flexerol is never taken for a long time. You become addicted. This is where people go rob houses. You see not trying to make it racist, you see young white kids, this is the type of drug dealing they do. You have on Vicodin, they sell oxycodone, and they sell these drugs. They sell Xanax. African Americans sell crack. And that's why when they catch a black man, they give you 25 years. When they catch someone other race, they give them like 2 years, because the effect of crack is higher than the effect of Flexerol. Crack cause you go kill people. Flexerol, you get a little high, you go to sleep, you may rob a bank, but you're not going to kill nobody. That is why a lot of people think it's a racist thing. Well, a black man get this. No, it has to do with what the effects of the drug. They sentence you by what the drug costs. Like this flakka business. People doing flakka all over Fort Lauderdale. Men wearing dresses in the street. This drug causes people to sell their soul. So if we find out you're the drug dealer, they're going to throw you away and lock you 30 years easy because the drug have major adverse effect. You got it? Yes. Yes. You taking Flexerol?
Yes.
Mm-hmm. You have pain, you have muscle spasm.
Yes. I never want to take big drugs.
You take the Flexerol?
I don't take it.
Okay.
Now, so I cannot more than a week.
That's right. But listen how you take it. You don't take it every day. You'll take it, you fine.
When I
Yeah, but, yes, but you don't take it every day.
No.
Anytime you take it every day, your body becomes tolerant to it. It's a feel-a-gooder. You can get addicted to it. Yep, parce qu'il faut dormir bien. And that's why it's in your closet. In your case, you take it whenever you feel you need it.
Yeah, no, it didn't even for 3 times a day.
Ooh,
But I take
that
it,
was a,
yeah.
don't take it in the morning because you drive.
I never take it in once in a while.
I know, once in a while.
That's
It's there as a cushion. Lord, this way.
exactly.
See, that's, you gotta be careful for that because that's an addiction. Well, if you don't need it, dump it. The reason you kept it, because sometime when you need it, you know it's there. Well, that's an addiction, Lord. You becoming an addict. No, I'm just you out. Okay. Then we go to Dentrium. Dentrium is muscle spasm. We normally give it in the ER. And we do give it IV, but it destroys your liver. So if you see the patient's skin turn yellow, the eyes turn yellow. You gotta be careful. Dentrium. Number 5. Page 878, number 5.
Given here?
Huh? They would normally give it in the ER. You can take it home too. Not the pump, but PO. But it's more, it works better IV. Okay? They give it, the first thing we have to watch the patient yellow. Yellow skin, yellow eyes, because jaundice. Anytime you see jaundice, that means the liver is infected. So anytime you give Dentrium, you got to look at liver enzyme.
If the patient already have a liver damage,
You wouldn't give it to them. You would question it.
Also, you check the liver enzyme before you leave it.
Parce que drug la cause problème à liver. So listen clearly. Si drug la cause problème à liver. Tendez, oui, tendez. Et puis patient te gen liver problem. Déjà. Et puis ouais body. C'est écrasé, ouais écrasé liver. English. If the and this is where students got a little problem too. Listen. If the patient already got liver problem, and you give me the drug, and the drug causes liver problem, what did you just do? Damage the liver worse. So these are the questions say, which drug would you question? What lab you will do before you give this drug? You see those questions? So the only way you're going to answer it if you what? If you know the content. So super comprendre. And don't go push the door hard. Você pode comer bien vite. Say, vini mesmo, she don't go there. My friend called me, Bissonia, mais student, people more la. Student, you go to Pearson, tombe à terre. sometimes you go in the bathroom and start exercising.
Yeah.
And you remember you on camera everywhere.
In the bathroom too?
And so she'll call me, she said, oh, so now, Koto Jean Moutsayo. She'll call me, right? Stephanie called me. One of my students went there and she fainted. Anytime you go to NCLEX, let me tell you something. Trick. Anytime you go to people test you fainted and they give you an option, baby, do you want to go home and come back tomorrow? Please take it. That's God giving you a sign. Anytime you go plantation, lumière fermée, lights go off. Sometimes they tell you, go break, come back. But if they say, no test today, for you to come back tomorrow, take it. That's God telling you yes. Yeah, if they say you can. Sometimes they say, go on a break, it will come back. If they say, go home, no lighting. Anytime in Pearson, light go off, they suspect cheating. So sometimes, special plantation, plantation, love light go off. I hate that center. Yes.
Miss Sonia, do they know right away the people in the front?
Yes.
You pass your film?
Pearson know right away if you pass.
Like the people in the front?
Right away.
So
No, the people in the front don't know if you pass.
Oh.
But once you take your test with Pearson, the test already graded.
Okay.
If you go to Florida and you call me right after you take the test,
You know.
I will automatically know if you pass. If you went to Florida.
Okay.
If you went to Hawaii, I will not know, but I'll show you how to do the trick.
Can
So
you do
students say the trick don't work.
It does.
The old trick don't work, but the new trick work. There's a
Takes-
way you gotta do the new trick.
If it takes your money, you fail.
The new trick, the new trick is not like the old way. The old way, if it let you enter your card, you fail. So that don't work no more. The new way, you must still put a card in. And once you hit enter, click, it take it, you fail.
So plantation is not a good place to take it.
Plantation is a horrible place to take it. Why? The people not nice. They always think people trying to cheat, so they not nice. Deerfield,
Yes,
sweet.
so
My
nice.
friend Stephanie there, she say, the students will go, don't tell Miss Sonia I was here. You gotta remember, every student, they don't know who you are. They don't know, but they could describe you. And they'll call me, Miss Sonia, you know the girl that sit here? She went. See, students talk. And the way I know you went is because a student called me and say, I went, but Miss Sonia, you had a lot of students there. And I say, what class? You know the one with the glasses that right away, I know you went.
What glasses? Which ones?
Unless you go to Orlando, I don't know. You go to Miami, I will know the students go there. Deerfield is my house. I love you to go to Deerfield. Deerfield, I get your score. I know right away. Right away. If you go to Hawaii, I won't know. That I won't know right away. You will know, but Florida, I will know right away. Okay? All right. Let's go to number 7. Yes.
That's if you buy your action.
Huh?
Like you said, Deerfield plantation. So
No,
then
you choose where you want to go. You choose what's good for you. You. So some people that live in Orlando like to come closer to here. Why? Because they rent a hotel, go there, take it, when they finish, they come dying here. It's okay. It's okay. So Orlando people like to travel. Whatever's good for you. Because there's a hotel next to it, Newport on Deerfield, and you can rent that and stay there and study. Whatever works for you. But I prepare you for all over the world.
The school doesn't choose the place where you go.
No. And anytime a school chooses for you, that's awful. The school choose for you because they looking to make sure you don't go burn their school down. So they watching. A school should know your business when you going. All you have to, they have to send you your name and that's it. If they have a good teacher, they shouldn't be probing. It's your decision where you want to go. But a lot of schools are doing that just to watch you because the schools are closing because students are failing. Okay, let's go. Roboxin. Roboxin is a drug that they give, right, when you have muscle relaxers. They give it for muscle relaxers, and they also give it when you are going into drug withdrawal. Roboxin, methocarbamol, right, make your PP turn brown, black, or green. Roboxin, when you give it IV, look, there's something can happen. It's called extravasation, meaning leak. And when you have Roboxin IV and you give it where it leaks, you can lose this arm, which is called compartment syndrome. So anytime you give Roboxin, guys, you must teach the patient the PP will turn color. They don't need to call the doctor. Okay? That you must teach them the IV, right, will cause extravasation. And anytime you give Roboxin IV, you must put the patient on heart monitor. It causes them to be tachycardia, hypotension, and also anaphylactic reaction. Okay? Any question? Okay, we're going to stop here. Now listen. So you see tomorrow no class. So watch with me on the calendar. The calendar.